Good evening, everyone, and welcome to our first MSK Kids webinar for 2021. I'm so glad that you could join us this evening. Tonight, we're thrilled to bring you a webinar on transition. Transition is a really vital period when your child moves from the comforting and warm embrace of paediatric care and out into the big, wide world of adult care. But don't be concerned. I'm sure after tonight's presentation, you'll feel well equipped to handle the process. Firstly, though, I just want to quickly chat about a recent initiative that we've undertaken here at MSK Kids. The initiative is Teen Talk. Teen Talk is an online portal for kids aged between 13 and 20 who live with a musculoskeletal condition or with a chronic pain condition. The idea is that they can log on to the portal, connect with one another and chat online. Now, they don't have to talk about their condition. They can talk about whatever they like, and we find they really don't talk a great deal about their condition, but it's really nice for them just to hang out with others who get it. The platform is run through Discord, and if you have teenagers, it's likely that they're already using this platform. But for more information, take a look at our website. The address is there on your screen, or you can drop me an email at any time at buffy@msk.org.au. Also on our website, you'll find a huge range of information, past webinars that we've done for kids and videos, including our extensive MSK Kids program, contact details for the free MSK helpline, where we have a nurse you can call, and up-to-date information on everything regarding COVID as well, which will be of interest to many of you. It's now my great pleasure to introduce Jamie McCarthy. Jamie is the Transition Support Coordinator at the Royal Children's Hospital here in Melbourne. Jamie's been a nurse at the Royal Children's Hospital for the last 25 years and has worked with the transition service for the last 5 years. Outside of work, Jamie's interests include surfing with his kids, presenting radio shows on community radio, and playing in a band called the Rectal Tubes. The Rectal Tubes have their own songs about bodily functions, so it sounds very fascinating. Jamie tells me that they're not very good, but they keep on practicing and aim to play 1 gig per year, and that they've been playing on community radio 3RRR more than once. So it's now my pleasure to hand over to Jamie. Thanks, Jamie, and don't forget to pop your questions in as we go along, and we'll have a question and answer session at the end. Thanks for joining us.
Thanks, Buffy. As Buffy said, I am Jamie. I work for the transition team here at the Children's Hospital in Melbourne. And I thought we'd start off with some definitions. So what is transition? We think it's about the purposeful planned movement of adolescents and young adults with chronic physical and medical conditions from child-centred to adult-orientated healthcare systems. So we often talk about the process, which is transition. The actual transferring of care is the actual moving. And what we want to avoid through this process of transition is on my next slide. So this was an actual quote from a young man who he said that he felt like, and this is prior to moving, that I feel like when I get transferred, I'm going to drown in the middle of an ocean with nobody around. And I'm really sad and nervous about moving to a new hospital because the Royal Children's has been my life. So how do we avoid this? This is going to be transition skills, life 101. We aim to see kids from the age of 15 and up, and we aim to see them at a minimum of once per year. We set goals, and our aim is to foster independence. So our aims, and if I could have 4 things that you take away from tonight, we want to make sure you can talk about your condition. We want to be, you're going to be managing your medications by the time you leave. You're going to be tracking your appointments, and most of it, important of all, you're going to know who to contact. So let's go back up to the top and talking about your health condition. You might have to talk about your health condition at school. We talk about special provision for exams, special entry access scheme. We encourage kids to talk about their health condition with their friends. And that might, you know, if you build up a script, you might avoid or have a script about dealing with peer pressure with drugs and alcohol and all things like that. We also help kids prepare for talking about their health conditioning interviews and what to put on your resume. With the medication management, by the time you're leaving here, we want to make sure that you're administering your medications, you know the names and your dosages of your medications, and we work on compliance skills. Also, by the time that you leave the children's hospital, we want you to be, almost going to the pharmacy on your own, or at least knowing what happens there. With appointments, it doesn't matter how you do it, as long as you turn up to your appointments. So we want you to, use what your parents do. So if they stick the appointment sheets on the back of the fridge or on the front of the fridge, that's how you're going to do it. If you're going to use your phone calendar, computer, whatever, we want to make sure that you know when to turn up to your appointments. And if you can't turn up, you need to tell someone. Also, by the time you leave the children's hospital, we'd hope that we're meeting the adult hospital expectations. So that might be that you have your last appointment, you build up to this of course, but you have your last appointment as a solo appointment with your doctor. Because that's the expectation when you get into the adult service. Also, we want you to know who your GP is, and if you require to meet them properly, then it's a really good idea to have an extended appointment time with them before leaving the children's. Because sometimes kids haven't used their GP at all. They rely on their specialist for a lot of things. And it's really important that you build that relationship. There's lots of things on your phone that you can use. So we encourage kids to fill out the medical ID on an Apple phone. It's inbuilt. On Android phones, you might have to download an app, but it's available there. And what we've discovered over time is that, not that we want this to happen, but if a crisis does occur and you collapse in the street, ambulance is called, from that medical ID app, they can call your the person that you nominate as your emergency contact. So at the Children's Hospital, we have a thing called the My RCH portal. And I think when we brought in the electronic medical record system, that was designed for transition in mind. So at the age of 16, unless you've signed a waiver, all the access to the My RCH portal goes to the young person. And from there, you can see doctor's letters, upcoming appointments, you can sync it to your calendar. There's blood test results, imaging results. It's available for you. We really believe that more information is often a much better thing. The last thing on there is taking a photo of your Medicare card. Believe it or not, you will have to get your own account eventually. And at the moment, I think it's when you stop studying or sometime around there. So just having a photo of mum or dad's Medicare card makes a difference going forward. All right. So our transition team is really small. You can see there, I think it still is, just over 2.5 full-time staff. We see most chronic conditions across the hospital. We require an internal referral to be seen by the transition team. My boss, Evelyn, has spent a lot of time building up relationships with adult services, and the aim of our journey with kids at the hospital is to have a joint clinic with their adult service. One of the big events that we have each year, and it's been really well supported by our CEO, who is about to retire, by the way, is the graduation ceremony. We invite kids who have been in our service, and they come along to the hospital. They get to shake the CEO's hand, get a certificate, and listen to some of the doctors that have worked with them over the time. It's actually a really nice event. It's a great way for young people to say goodbye to the Children's Hospital. So why do we exist? There's a difference between RCH and adult services. So at RCH, we have family-centred care. That's one of our goals at the hospital. If you wanted to bring grandma and granddad, mum and dad to your appointment, we would talk to them all. In an adult service, all the information goes to the young person. We've heard of doctors being quite confronted when young people bring their parents to their first appointment, even to their first appointment, to the point where they have been excluding the parents and saying, you know, that's not your job anymore. At the Children's Hospital, quite often it's a very familiar environment. And if you haven't been to here, it's a very flash new building. In an adult service, you're quite often going to an older building, older environment with lots of older patients around. It can be quite confronting going there the first time. A lot of services that young people use at the Children's Hospital at the hospital. Often in adult services, they are referred out to community services, so somewhere closer to home. A lot of care at the Children's Hospital is subsidised, so kids and families find that when they do move, there is a higher cost associated with equipment and medication. We want to avoid being lost to follow-up. The biggest thing that we want to avoid is crisis management. We want you to have links and know how to access care. We want to avoid poor health outcomes, lower quality of life, poor psychosocial outcomes. There's an increased burden of care if that happens. So we want to avoid you coming to the emergency department in a crisis. And the way that we want you to be linked in with your adult service is exactly that, building a relationship. So how do we promote self-management? We aim, perhaps after the first appointment with us, to see the young person alone. We identify goals. We also aim for medication compliance. There are really simple things that probably a lot of you are doing right now. We suggest that you use a dosette box, use reminders on your phone. We try to move you away from relying on your mum and dad to remember to take your medication. And sometimes we even encourage people to use people outside the family to provide those reminders. And believe it or not, that might be your friends. We offer a really positive reinforcement of change too, because we realise that this is your journey and it can be really rewarding when you're really taking a part in it. Now, in the past, we perhaps didn't see as many patients as what we did. Our services broadened its horizons, and we used to be able to offer a little bit more of a mentor role. And I will go back to one of my colleagues, Beck, and she has a cardiac condition. She doesn't mind me saying that. She's an ex-patient of the Royal Children's Hospital, so she's had those lived experiences. I think she actually really adds a lot of value to our team, and there's lots of things that I might refer back to Beck later on with this. But we aim to have coordinated early transition planning with young people and their parents, and we aim for them to be independent almost by the time that they're leaving here. And they're some of the systems that help us do that. So why? Well, actually, some parents, not all parents, find it really difficult to let go and perhaps even let failure occur with their kids, because they're being just as invested as you are, perhaps even more so, than with building your health, building routines. So when it does come time to move and transfer your care, navigating a new system, one that they often don't know, is really confronting. Knowing who to contact is really the key. If I can go back to Beck for a moment, she has come from Perth. So she doesn't see her parents all that often. Whenever she sees her parents, the first thing that they ask her is, have you been taking your medication? And that's been she's lived out of home now for over 10 years. So it is amazing that even though the parents have, let her live in another state, manage her healthcare. She's doing all that. The first thing they ask, have you been taking your medications? I actually find that really interesting. So some of the paediatric clinicians also find it really difficult to let their young charges go. They're not really sure well, actually, this is much improved now with the joint clinics, but there wasn't a lot of trust in their adult counterparts, all the GPs that they were dealing with. So paediatricians sometimes find it really hard to let go from their young clients. Some of the adult care perspectives, they're not sure about how to deal with teenagers. They often think that the parents are over-involved. The transfer of information can be scant, and there is the perception that there is a little bit too much hand-holding going on, and the demand for accessibility can be, there might be a little bit of a mismatch, but that's where I can find the most important thing is to know who to contact. As I said before, Evelyn has spent a lot of her time creating links with adult services. The joint meetings and joint clinics that we have established relationships, and I think it's improved our relationship, the children's relationship, with a lot of adult centres. And I think that comes down to my boss, Evelyn Conley. So let's go through the model of care. This is the ideal model of care at the Children's Hospital. So a young person will get referred to us at about the age of 15, and we start talking about transition. So we might just establish that you're going to transfer your care after high school finishes. It might be in the December when you finish, it might be early in the first part of your year out of high school. We develop goals. And some of them are really, really simple. Some of them are just taking a photo of your Medicare card. How long does that take? Taking a photo, favouring, whatever that means. And then by the end of your time at the Children's Hospital, we aim to have a joint transfer clinic with clinicians from RCH and the adult service, often meeting together. So if we look at a young person with a Fontan circulation, so it's a cardiac condition, so we see them at the age of 15, we identify the goals, and we track those goals. So we try and reinforce them, we try and give them resources if necessary. Then we might gather some support around that young person. And finally, when they're about the age of 18, they've finished high school, we have a joint transition meeting. And so that might be just the half an hour before we have the joint clinic. But then we have a joint clinic with the young person and the staff from the adult service. And then after that, they're going to have their first appointment at the Royal Melbourne Hospital, because that's where they'll transfer their care to. So there's lots of information on our website. We have lots of resources. We have stuff about studying, we have stuff about jobs, we have stuff about dealing with stress. We have transition passports, we have lots of checklists. Feel free to go to that website, it's freely available, and have a look at it. There is some services around the world who have adapted our resources to use for themselves, and believe it or not, one of the services in Finland has adapted one of the checklists, and then the other two, they're from a Brisbane hospital. Now, as I said before, transferring information is crucial. So one of the greatest things that I think has happened at my time at the Children's Hospital has been the electronic medical record system and the associated patient portal. So from the portal, you get access, if you create an account, you get access to the information till you're 25. And it runs alongside the portal that is now at the Royal Melbourne Hospital, the Health Hub, and you get access to, I don't know, doctor's letters, script information, medications. There is a message service on there. Prior to the portal coming online, we used to spend a bit of time organising USBs for kids. We have a special relationship with the health systems downstairs, and they're able to provide us with scans of discs as well as USBs of some of the medical record system. You can also get access through Freedom of Information. I just want to reinforce those 4 take-home points again. So if you've got time now between 15 and 18, it's really time to start working on your knowledge of your understanding of your condition, working on the medication management, learning to track your appointments, and one of the most important things of all is knowing who to call and who will answer.
Absolutely. I think those are great points, Jamie, and thank you so much for that, that presentation. I know as my son moved into his transition stage, his clinician constantly asked him those questions, and as we'd be in the car driving to his appointment, he'd say to me, "Mum, just remind me, what milligrams am I on again?" Because he knew exactly what he was going to ask. So if they can get those things under control,
I actually encourage kids in their first appointment at their health service, if they've got access to the portal, have it up, have it open. And you can use that as a backup. Everyone feels a little bit nervous meeting new people. So having even just a list of your medications in front of you, yes, I take, oh yes, it's called this, and it's in this amount.
That's right. That's right. You don't. Yeah. It's good to know it off the top of your head, but you can also refer back to your notes. So I think that's very important for kids to know. So a few questions as people. People, please feel free to write your question in the box on the side, and I will get to them. But I've got a few here now for you, Jamie. So I'll start. Okay, the first one is, what are my child's options if they don't like the clinician or the practice that they've been transferred to?
That's one of the final appointments we have with kids. We remind them of their healthcare rights and responsibilities, and it is their right to choose where their care belongs. It can be really difficult though, having said that. A lot of specialists only operate in one hospital or one healthcare system. So finding another, if it is a very specialised field of medicine, it can be really difficult to transfer your care. But talking to other people, finding out what other options are available, believe it or not, even talking to the service that you're currently at, they will give you some options. Again, knowing who to contact. Often we encourage kids to get to know the nurse coordinator. They are wells of knowledge. They're really accessible usually. They're willing to answer your questions. They're willing to answer the telephone. So finding out where the other options are, quite often there are other options available. It's just about getting a new referral, and often the service that you're at will give that new referral to the service you want to go to. Sometimes I think a lot of kids can find it overwhelming the first few appointments. So I'd encourage a few repeat appointments, because those differences in care are huge. And they're going to take a little while just to get over, I don't know, the noise in the waiting room. The fact that you might have had to wait, a longer time than what you're normally used to. Those, and I'm not going to understate them, but those kind of things, after going to the new service for a little while, don't seem to be as much of a big deal anymore. So persisting, and what we say to kids is, it's worth waiting 2, 3, 4 appointments in before you decide to change your care. Obviously, the RCH has sent your care to an adult service that they trust, that they have faith in. So it's worthwhile persisting. But as we said, it is your right to choose where your care belongs.
Thanks, Jamie. We've got another question here. Does the Royal Children's Hospital assist with locating GPs in the community that are well informed about that child's condition?
Yeah, we don't officially. However, my boss Evelyn has a list of GPs who have been recommended by parents, not by the medical teams here, but by the parents, other parents who have got similar conditions, and she keeps a list. You know, maybe getting into trouble here, you could contact the transition service, and we'd be happy to provide the list of GPs that we have found from our patients that they really like, and they really like because of the reason, whatever condition that they're involved with. I would also just, if I can, I would ask other parents and other patients of GPs that they go to. It's usually a word of mouth thing, and that's what we're relying on. So it'd be worthwhile asking other people that you know whether they're used to dealing with the patient's condition, but also whether why the reason that they like going there.
Yeah, look, I agree with that, and that's something, if people do have those sort of questions, that they can email through to me, and I'm happy to share on our MSK Kids Facebook page, and you can get a lot of good, knowledgeable information from other parents that are living locally with the same sort of thing. So another question has come through actually about a GP. So it says, whenever I go to my GP, they refer me back to my specialist. So I know myself, I've had this, when my son is in a bad flare-up and you take him to the GP, they sort of say, oh, hands off, go back to your specialist. What should I do?
Obviously, the specialist is where the expert care is at. It might be worthwhile encouraging the GP to maybe contact the specialist on your behalf. Sometimes, well, yes, that can be difficult, but having that contact through the nurse coordinator, they can provide a lot of information to GPs. That might be worthwhile making that suggestion. Having a flare-up plan from your specialist passed on to your GP is a really good idea. That way that you can try X, Y, Z. Okay, I've got the specialist recommendations here. Let's try this first before you go back and see them.
Yeah, I think that's a great idea. Okay, next one we've got. You mentioned moving into the workforce and helping kids prepare a CV and so on for their first jobs. My child is going for their first job. Should they disclose the fact that they have a chronic health condition like juvenile arthritis?
Legally, you don't have to, okay? And however, if you're asked a direct question, you have to answer that honestly. And we believe that honesty is the best way forward and the only way forward. We would recommend that you at least talk about it if you need to, and if you're asked to, but you play it down. Is it going to affect you at work? Maybe not. But there might be times where you need to go see a specialist. There might be times where you need time off. I wouldn't start with those kind of situations, but preparing a statement, explaining what the condition is. What we encourage kids to use is a positive. Are there any positives from having a chronic health condition? And I would argue that there are, but it's about how you express it. So I would say that any child with a health condition is a little bit more mature than their counterparts. If they're managing their medications, they're organised, they're responsible, and they're often more resilient than kids who haven't got a health condition. So I would explain what the condition is, say it's no big deal. I do sometimes have to take some time off, but you know what? It's made me more mature. And hopefully employers are going to latch on to that positive rather than any negative connotation that they have about their health condition. But we would say honesty is the best policy. There is on one of the on the website where our resources are, there's a blue booklet talking about jobs. It'd be worthwhile having a look at that.
Really, yeah, that's really great to know. Thanks, Jamie. I've checked that one out as well. A new question's just come through. Can you elaborate on the difference in costs that you mentioned between paediatric care and adult care, please?
So sometimes medications are funded differently from a paediatric centre to an adult centre. Often kids have got a healthcare card before 16 and they may lose that after 16. You can apply for an ex-carer's healthcare card, which can make medications cheaper, but usually there is a greater cost of medications in the adult service. I can't tell you exactly the difference.
I was going to ask, in Australia, are we talking a great deal? I mean, I know overseas, obviously, there is a great difference in costs, but in Australia, are you looking at exorbitant costs, or are you looking more around the, say, $30 or $40 for a script rather than the $6.20?
Exactly that, yes. Yeah. And I don't want this to be an advertisement for certain pharmacies, but there is a difference between pharmacies as well. So it is worth seeking out a cheaper pharmacy. It can make a huge difference.
Yeah, absolutely. A bit of shopping around.
Yeah.
Is there a legal age at which kids can get their own Medicare card?
From 15 and up. You can apply through the Centrelink website. As soon as I mentioned Centrelink, some people have a bit of a shudder, but you can apply. We encourage kids to stay on the family card though. If you're more likely to meet any thresholds in terms of medications and things like that as a family rather than as an individual. It is good though to have your own Medicare card because it provides one of the, or a portion of the 100 points of ID. But we would recommend it while you're studying, stay on the family card. There's no difference and you're more likely to get benefits out of it.
So if a child is, or young person is on the family Medicare card, can they have their own copy of the card, or do they have to ask their every time?
They can get one copy of the card. Yeah.
Okay, so one copy of the card, each person on the card. So you don't have to say to mum, I want to go to the doctors each time.
No.
You can do it privately.
We would recommend though, just taking a photo, save it on your phone. It's the next best thing. They actually don't need the card. That's the whole idea behind the MyGov app as well. But you've always got it with you, provided you've got your phone.
Okay, that makes sense. Okay, got another one here through. Is there a certain age that children must leave paediatric care by, or is it governed by that child or their condition?
The general rule is that they will see you until you finish high school, and then you might have an appointment or two after that time. So for most people, they'll be at the Children's Hospital until they're 18, possibly even 19, and then transfer their care. That's the general rule. There are some very selected times where they do perform certain operations here, where they will keep the child here for that operation only. But yeah, then after that, they send them on to the adult service. So the general rule is that when you finish high school is when you transfer your care.
And assuming, say, if you leave school at 16 to go and do a trade, does that mean that you transfer at that stage as well?
Then it comes down to your doctor, and they might rely on us to say, are they, operating at an adult level? So some kids do transfer their care. Some kids find it much easier to go to the adult centre because of travelling. The distances that some people have to travel is enormous. So some kids do transfer their care early, and that's fine. So generally they can do that from the age of about 16. But yes, general rule of thumb is that even if you are, getting a trade, you've left school, they might keep you until you're 18 anyway.
Okay. Yeah, makes sense. Okay, new question just come through. Thank you, Jamie, for the presentation tonight. Do you know if Monash Children's Hospital have a similar type of transition program?
They don't officially. We're quite unique, not just in Australia, but in the world. There aren't many transition services that are hospital-based. So I know in Sydney they have an organisation called Trapeze who are external to the hospital and they get referrals. But we are one of the few hospital-based transition services in the world. I think there was they felt that there was a need within the Children's Hospital to smooth out the process. And my boss, Evelyn, has really taken that on and really developed the service. She's been here for probably 10 years now. And she has developed relationships within and outside the hospital that I think has improved the care of the young people that we see here.
Great, thanks, Jamie. The next question is on a similar topic. So it says, you mentioned transitioning at Royal Melbourne Hospital. Does the Royal Children's Hospital have good links with Monash Hospital to transition to as an alternative option? And would the same group meetings take place?
Generally, yeah, that's a good point. We have good links, and a lot of the doctors know doctors that they will refer to at Monash. We do have some joint transition meetings with Monash, but generally they're lower. Our major catchments of adult services usually based around the Children's Hospital because Monash have their own pathway, it's right next door. So generally we don't transfer a lot of kids, we still do, but we don't generally transfer a lot of kids to Monash.
Yeah, so I guess that makes sense compared to, and also you would draw kids from certain areas that would be more likely to be in that Royal Melbourne area, while Monash would probably draw from the southeast and have more kids going to that hospital. Just for those that are at Monash, my son went through Monash, so I can tell you a little bit about that program. So from the paediatric care, he certainly had those sessions in his last year of being there, from sort of 16, 17 to 18, where they would have one-on-one conversations with him and I would leave the room. And obviously, as I mentioned before, he was quizzed on his medications and so on, so he needed to be up to date on all of that. So that got him ready for the move. He then transferred within Monash to the Monash Adults Clinic, and once he'd had one appointment in the adults clinic, he was invited back to the children's to have another appointment if he wanted to discuss and share anything, or if he had any concerns that he wanted them to perhaps mediate with the adult clinic. For him, he felt that he didn't need to go through that process. He felt comfortable in the adult clinic and was ready to move on by that stage. But that was an option for kids as well. So I think at most paediatric hospitals, you know, there's a fabulous nurse that you can chat with about these things, and every kid is different, so they're going to have different needs and so on. But you know, I think Royal Children's obviously has a fantastic service, but other hospitals, don't be alarmed, there will be services available, and you know, you will be able to talk with your nurse and work out what's going to work for your kid. No one's going to be pushed out of the nest and left unprepared. I know when my son moved, there was quite about a 6-month waiting list. And so during that time when he needed scripts, we just went back to our paediatric nurse and she organised scripts for him to cover that period. So it's not like you're left out on a limb. So, yeah.
What we encourage kids to know is you actually haven't officially transferred your care until you've seen the adult service. So in that time, there is a bit of a grey area where do I belong? We always encourage kids that you belong at the Children's Hospital until you're seen at your adult service. Yeah. And I would really, I can't overstate the fact that the nurse coordinators are the key linchpin to a lot of services. You need to make sure that you know who they are, know their contact details, because they're the ones who are going to deal with you. They're the ones who are going to pick up the phone, answer the email. Yeah. I have to let it be known that I am a nurse.
Couldn't agree more. Okay, so we've got another question through. Do you also help with locating informed physios, ophthalmologists, or etc. to transition to the specialised care required. So I guess if they've been seeing a paediatric ophthalmologist, do you refer them on to an adult ophthalmologist, same for physio, podiatrist, occupational therapist, whatever else it might be?
Yes, the answer is yes. So a lot of the ophthalmologists here at the Children's Hospital, believe it or not, will refer to themselves as the Royal Melbourne Hospital. So that's an easy way to get across there. The physios, a lot of the physios here at RCH have links already with those external services. So initially they might refer you to the hospital-based ones, but then they might refer you out to a local community physio from there, or the children's physios might do that automatically and do it directly so that there's not the need for the middleman.
Okay, perfect. Thanks, Jamie. That has brought us to the end of our questions. So if anyone out there does have a question, type it in for us now. Otherwise, Jamie, did you have anything else that you thought we should add?
There might be, I'm just interested to know the first time that when your son met the adult service, did you sit down the night before and write out some questions together?
We did talk about what he needed to ask, but I actually did go along to his first visit with the adult clinic, and then after that I didn't go along. So, but I'll tell you, the whole experience of going into an adult clinic and seeing older people living with a condition is quite daunting to young people as well. And I think, you know, people do need to sort of bear that in mind. You're sitting in a waiting room with people who've been living with a condition for many, many years and perhaps didn't have the medical care that is available to our kids now in their earlier lives, so might have more confronting condition than our kids are living with. So yeah, they do need that little bit of support through those first couple of lessons. But I think once they're into it, once they've got a relationship with their care, their doctor and provider, things are fairly smooth sailing. But it is something to bear in mind. It is a big change from moving from the children's nice, comforting area of the children's care.
It's with green walls.
Yeah. Oh, so we have got a couple more questions just come through. How do we access your Royal Children's Hospital portal?
You need to get a code, and you can get a code at the reception desk, or you can call the Children's Hospital IT number. They will require some identification to be sent through. They will give you a code that lasts for 2 weeks. You've got to activate your code within 2 weeks. That creates your account. Then you can download the app, log in. Due to COVID, they did change the process. They used to you have to be present to get a code, but now they're happy to do it over the phone, provided you can provide some identification. Excellent.
Okay, and another one's just come through. If your child receives a free script of Humira through the drug company, which is organised by the paediatric rheumatologist, would the adult rheumatologist be able to continue with this?
That depends. Often it's a compassionate supply that is being provided through the company. That would require the same application that the paediatrician or the paediatric doctor has gone through for your adult doctor to go through again. So that's a discussion to have with your adult service.
Yeah, that makes sense. Okay. Questions are coming in thick and fast now. I apologise if this was covered while I stepped out briefly, but how long do the youngsters have access to Royal Children's Hospital app after they turn 18?
So they can access till they're 25. I don't think anyone has reached that point yet, but you're meant to get a text to say that when you're close to turning 25, please check it out for the last time. You will lose access to it when you turn 25. Yeah.
And are they able to download the information that's on there if they want to say
that? Yeah, they can print things off it because everything on there has been provided to them anyway. It's just the way that's been provided. Back in the day, would have received a letter home. Now they receive the letter on the app.
Yeah. Okay. And do you transition from Royal Children's to Royal Melbourne outpatient clinics, or can you move to a recommended private specialist?
Absolutely, you can go privately. And that's entirely a conversation for you and your doctor. If you found a private specialist that you want to go to, absolutely, they'll be more than happy. Write the referral and off you go. Most of the time, the vast majority of kids will go to a public service, but that doesn't discount going privately.
Yeah, absolutely. I know in the public service, obviously, you get a lot more of your costs covered, but I think you said during your presentation that once they move into adult care, even when public, there may be more outpatient, out-of-pocket costs anyway, yes?
Yes, not for being seen by a doctor in the public service, but perhaps medication costs will be more. Yeah, that's what I was referring to. Yeah.
And would that include things like physio appointments and ophthalmology and stuff as well, or were they covered fully in public?
Ophthalmology, if it is through the public service, is covered via Medicare. Some people prefer to go privately with ophthalmology though, because sometimes the wait times in the public system can be really long.
Yeah, absolutely. All right, well,
I will say one more thing. Having that relationship with your nurse coordinator, it's amazing what they can help you out with in terms of moving you around on waiting lists. I didn't say that, and don't quote me, but that's why you have that relationship with the nurse coordinator, so they can help you out.
Yeah, absolutely. Okay, Jamie, well, we seem to have come to the end of our questions from our viewers, so thank you so much for your time this evening. I'm sure that was a hugely informative chat for people to listen to and get their head around, and I think it's important to start thinking about that transition process as your kids enter the teenage years. So rather than thinking about it at 17, you know, we need to be thinking about it at 14 as they're coming into it and starting to get them used to that idea of being a little bit more independent in their care. So thank you so much. I would like to quickly, seeing we've still got a few minutes, to remind people about Teen Talk. It's a great resource. We've got quite a few young people on there now. It's an online chat group for teens with juvenile arthritis or any other musculoskeletal condition or chronic pain condition. So if you're interested, have a look at our website, check it out. We've got lots of frequently asked questions there, questions about safety and security, which I know parents might be thinking about. A lot of your kids are probably on Discord already, which is the program that we're hosting it on. So jump on board. Or send me an email if you do have questions, buffy@msk.org.au. And once again, there will be a quick questionnaire coming up at the end. If you could give us your feedback about tonight's webinar, that would be great. We'll be sending a link out next week so that you have the webinar to watch again at your leisure, and will also go up on our website page. So thank you everyone for coming along tonight. And thank you, Jamie, for a fantastic presentation.
My pleasure. Okay. Thank you.
Good night.